there's a public health crisis that's happening across the nation. When we think about those numbers in across the country, it's 3 to 4. Black women are and Black birthing people are 3 to 4 times more likely to die in childbirth than their white counterparts. But when you look at those numbers and apply it to New York State, it can be anywhere from 3 to 5. And then when you look at New York City, in certain boroughs like Brooklyn, it could be as high as 12, 12.9. So the numbers are staggering. And
Our guest today is a woman whose life work embodies the very heart of this conversation, reclaiming joy, dignity, and equity in Black maternal health. Dr. Ashanda Saint Jean is a proud graduate of the Sophie Davis School of Biomedical Education at CUNY Medical School and earned her medical degree from the New York Medical College. She completed her residency in obstetrics and gynecology at Danbury Hospital, a Yale New Haven affiliate, and is a board-certified OB-GYN. For more than 2 decades, Dr. Saint Jean has delivered high-quality, culturally responsive care to unrepresented women in both urban New York and rural upstate communities. Her approach to medicine is holistic, integrating mental health, addressing social determinants of health, and ensuring that every patient's voice is valued. Dr. Saint Jean has served in numerous leadership and academic roles, including a former chair of obstetrics and gynecology at Health Alliance Hospitals of Hudson Valley and as an associate professor within the Department of OB-GYN. Please join me in welcoming Dr. Ashanda Saint Jean.
I have to say, I am the daughter of Elbert Smith Phillips and Marva Phillips, and I think that I generously give everything that I am and who I strive to be to my parents and their sacrifice just for my education. I'm born and raised in Queens, one of 6 children. And my mom wanted to be a nurse, but had 6 children. And so I kind of led on the legacy of a path and career in medicine because of what she strived to do in her own life. And again, I contribute all of my success to my parents.
So today's episode is all around this concept that you constructed around reclaiming your joy and just the conversations on Black maternal health. So let's dive into that a bit. You said that returning to joy and the birthing experience is essential, which I would 100% agree. As a new mom myself, recently giving birth to a little boy just 2 years ago, why do you feel like that framing of joy is so critical when we talk about Black maternal health?
Well, I think first and foremost, we have to recognize that we and Black women, so I say that as a Black woman, have the highest rates of maternal deaths across the country, right? And so I think given those statistics, and they're staggering, right, that we can identify that there's a public health crisis that's happening across the nation. When we think about those numbers in across the country, it's 3 to 4. Black women and Black birthing people are 3 to 4 times more likely to die in childbirth than their white counterparts. But when you look at those numbers and apply it to New York State, it can be anywhere from 3 to 5. And then when you look at New York City, in certain boroughs like Brooklyn, it could be as high as 12, 12.9. So the numbers are staggering. And so what happens is this is stuff that's in the news. And so when patients find me or if they're seeing me for their obstetrical or their prenatal care, one of the biggest things they'll say is, I don't want to die having this baby. Or when I see people who are pre-gestational, right? They haven't even gotten pregnant yet. They will say, I don't think I want to have a child because I don't want to die having a baby.
So I'd like to just dig a little bit further when we talk about medical mistrust and just the impact that cultures play on this, right? So I'm first generation born here in the U.S. My mom born and raised here, but born in Jamaica, and then my grandmother, of course, gave birth to her children in Jamaica as well. And we definitely do have a history culturally. Not just as, Caribbean and West Indian folk, but also, as Black and brown people when it comes to medical mistrust. My grandmother, when she gave birth, interestingly enough, she was pregnant with twins at the time, and they held out on delivery because one baby they said was ready, the other was not. By the time now it's time to give birth, now we have one twin deceased, stillborn in the womb, and the other, ready to be born. And so just historically, that now comes out. Now it's my turn to give birth, and there's sort of this imposition oftentimes of, well, be mindful of that, and don't let them this and don't let them that, because there was no ability to choose your physician. You went to where care was there. The equity and access rate is way down. There was no choice. You went to where there was an opportunity to give birth, and with decency and dignity. Whereas now, we do have a choice. And so when I also think about just even, Black Americans, and, people do not trust physicians, just curious, your perspective on that, and just the impact that culture plays in medical mistrust when it comes to folks' birthing experiences and pregnancy experiences.
Well, I think I want to separate two different things that you said. So, first and foremost, I want to believe that everyone has access, but they still don't, right? There's many providers, right? But some don't accept new patients, don't accept your insurance. You can't get an appointment for months. So, we kind of embody that as social determinants of health. So, these are non medical factors that impact outcomes, right? And so that could include access, availability, health insurance, that could be transportation, that could be education, or even medical literacy, So I think it's so many things. So we want to believe that everyone has access now, but can you believe that throughout the country and throughout New York State, there are so many healthcare deserts that still exist? Even when I was upstate, people drove an hour or two to come see me because there was no other doctor. So
Yeah.
I think that's one thing. And I think the second part is generational trauma, right? So these things are passed down, right? And so we know that there is an impact, and it's called weathering, where generational stressors, racism, discrimination, they can impact and cause medical conditions in our body. So, again, just like what you described, if you heard that this happened to my grandmother, then if there was something that happened with my mother, then those are all worries and anxiety that you may have when you're carrying your baby, right? And I'll just give you the example of my grandmother had preeclampsia, my mother had preeclampsia. Now I'm worried I'm going to have preeclampsia. So see how that would impact you and give you anxiety for the
Yeah.
whole entire pregnancy. So there's no joy, right? There's no, and like you said, I loved how you said it, not having the best day of your life, having the best 9 months, right? And even thereafter, right? And I think that when we think of those things, we have to be intentional, right? So we have to develop systems that really improve that experience, right? Because we know improving that experience, we can also improve someone's mental health during the pregnancy and thereafter. And we know that there are studies that are done out of Harvard where they have actually looked at generational traumas and stressors and how that impacts babies in the womb.
You have, a patient toolkit, and this patient toolkit, I know, highlights, shared decision making of doulas. And so you touched on it pretty heavily, but if we could just recap why these supports are so vital, of doulas, midwives, or any other, supports within the toolkit, that you could name for our
Yeah.
viewers.
Well, I think it's important that you receive care within a lens of trauma informed care, right? Like we said, there's generations of bias, of racism, of discrimination. People don't want to go to a provider. Some people don't want to OB. And I have to say, okay, all right, you know, and sometimes, that has to be respected. Some people want a home birth. They want to deliver at a birthing center. As long as they're an appropriate candidate, and of course, making sure a risk assessment has been done to make sure that they are within the framework in terms of risk that they may deliver there. We want people to be empowered. So when we think about toolkits, it's selecting your provider, researching, being intentional about selecting someone who is right for you and your family. and whether that be you and your partner, the father of the baby, your loved one, we want to make sure that that is a perfect fit, right? Number two, making sure that you're able to have your birthing plan, right? And so you can, as much as an unknown experience this is, how can we kind of weave in empowerment and self-advocacy and just agency in that? So telling me, I don't want you to ask me if I want pain medicine, right? I want to tell you when I'm ready. Or I want my spouse to cut the cord. Or I want delayed cord clamping. Or I don't want my baby to be washed before it's handed to me. There are different things that you can say, I want this or I want that, right? And those are discussions that can be had, making sure, like one of the things I love to do is I want you to create the scene of the delivery room. Do you want music? Do you want to create a playlist? Do you want to kind of decorate the room with pictures of your family, or do you want to have your own ball and bring your own ball in? Do you want to wear your own pajamas? Do you want to have your own robe? Do you want to have your own pillow? Do you want to have tea lit candles, not real flames, the ones with the battery, but sometimes you want that all around you, right? Some patients will put up a tapestry, or some kind of adornment that reminds them of home or just gives them a sense of safety. There are opportunities that we can be very intentional. Sometimes you want to mirror and watch as you're pushing to see how you're advancing the baby down the pelvic canal.
That helped me 100%.
So there are things that you can do. And when we say a toolkit, it's preparing, right? Just as you prepare the bag or the luggage for the hospital, right? One thing I always tell my patients, have snacks. Listen, sometimes going through this, you need your favorite thing. That's M&Ms, then maybe you need some M&Ms or whatever you're providing, you discuss, and it's allowable. I think we can have intentionality to really kind of arrive at comfort, at joy, at a peaceful journey through birth, that you so rightly deserve. I think that this can be one that we return to joy, because it once was, right? And so without these kind of really horrific healthcare disparity statistics, we're not at the joy that everyone deserves. And I think that should be universal.
Yeah. And that brings me to my next question. What would you say your core message for healthcare providers and policymakers to ensure that joy remains the center of maternal care? What would that message be?
Well, I think the framework of obstetrical care should be grounded and centered on the patient, being valued, being listened, having agency, and receiving a trauma-informed care lens that is one that is empowering, but also uplifts the mind, body, and spirit.
I think that is so powerful. And so, ashe to all of what you just shared. I'm so grateful that we got to have this conversation and just share space. And if you don't have any final thoughts that you love to share with the audience, I want to thank you for being with us. I want to thank you for all of your wisdom. I want to thank you for your advocacy. I want to thank you for ensuring that women like myself are able to find joy in their birthing experience. And so, again, on behalf of Sister to Sister International, we thank you and we appreciate you so much.
Thank you for this opportunity. And just remember, you deserve happiness, and it is your right. So you go out and you seek it and you arrive at it whatever way you can, but you deserve it.
Agreed. You deserve joy. With that said, we will see you all next time.